Good morning, this is Fighting Fear with Kevin Ashworth. I'm Kevin Ashworth. I'm the co-director of Northwest Anxiety Institute in Portland, Oregon. It's Monday morning, October 10th. Today is important because yesterday marked the first day of the OCD Awareness Week, which is awesome. So I want to get this video out there. Please share this with everybody you know, because we don't know who in fact is struggling with OCD, and that's why we want to create awareness for that. OCD really is categorized as an anxiety disorder, although there has been some changes to that, but OCD stands for Obsessive Compulsive Disorder. To provide a little bit of explanation about what OCD is, the obsession is really any unwanted thought, any intrusive unwanted thought. The compulsion is anything people do that mitigates or manages the anxiety associated with that compulsive thought. So OCD is not being quirky. OCD is not just liking things straight and orderly. OCD is not necessarily just liking things clean or being rigid or having preferences. When people talk about themselves in this very kind of general layman's term of OCD that is popular these days, we actually kind of minimize the struggle that millions of people have with OCD. OCD impacts 2 to 4% of Americans and is an absolutely devastating disorder. The issue with OCD is not everybody that has compulsions are overt, meaning you can't see their compulsions, and so many times people are engaging in mental rituals just to manage their other thoughts, to challenge these nasty, awful, intrusive thoughts that are often related to the things that they care deeply most about. So please think about this today. Somebody in your office has OCD, somebody in your classroom has OCD, and maybe even a family member has OCD. The difficulty is because they're not sure necessarily it's OCD because they don't do the quintessential washing their hands and worrying about germs, which is still a very debilitating symptom of OCD. And so there's different categories of OCD. One is contamination fears. So individuals with OCD may worry that they're contaminated in many different ways. One could be from touching something. One could be from inhaling something, whether that's car exhaust or cigarette smoke, or one could be from any other environmental contaminants. Another type of OCD could just be a just right feeling. And so things have to feel just right. So I have to pick my coffee cup up and set it down until it feels just right. Of course, there's no actual logical reason that this would feel just right, and that differs from person to person. There's harming types of OCD where people with OCD actually worry that they may harm other individuals. This is very different than having thoughts of actually hurting other people. This is a worry, this is a concern. OCD is nicknamed the doubting disease. People with OCD constantly engage in this reassurance seeking and doubting. And many people with OCD worry that they're going crazy for this reason. Your brain can actually create so much doubt that you're now confused whether you've actually engaged in something. So an example of that could be, if I've been doing this video, I have not in fact had any of my coffee. And I could have a thought right now. Have I had some coffee? Did I get some coffee? Maybe I did. Well, now I can't remember. And of course, even asking yourself that question creates doubt because our memory is limited. Our memory is up to problems at times. So people with OCD really, really struggle with this, and they typically avoid. The best compulsion for any kind of anxiety is avoidance, and so you can imagine that if you have OCD, your life gets narrower and narrower and narrower. And when you hear people joking about OCD, you're less likely to talk about it with other ones, and you're less likely to seek help. The number one treatment for treating OCD is a type of cognitive behavioral therapy called exposure response prevention. That is the gold standard treatment. Research also suggests that if medication and treatment at the same time is very, very helpful. This medication is typically an SSRI or what most people consider to be an antidepressant. And so taken together can be very, very helpful. Again, it's necessary that if you have OCD that you try and find somebody that understands it and seek help. The International OCD Foundation, iocdf.org, is an amazing resource for people struggling with OCD. It also gives you a link or a list of providers that are certified or at least acknowledge that they have specialization in the treatment of OCD within your area. And if there's nobody in your area that is on that list, then I would look for someone that does cognitive behavioral therapy, and they would be able to build their skill set in order to do exposure response prevention to help treat your OCD. I work with some amazing people that struggle with OCD, the most interesting, intelligent teens and adolescents, and also extremely successful adults. Successful financially, successful in their business, successful in their area of expertise, in their studies, in their families, in their relationships with other people. So it's a very unique diagnosis, and that, in fact, although it is so debilitating to so many people, also a lot of people manage somehow to remain very, very successful. It just kind of speaks to their resilience and their strength. So think about this week. People struggling with OCD, and of course the people that you don't know who may be struggling with OCD. And also keep in mind, when you find yourself, if you're one of those people, saying that you're so OCD because you like things straight and orderly, when really that's just as a personal preference and actually has nothing to do with a debilitating psychological diagnosis. Thank you so much. Please follow me. Please subscribe to my channel. I think you can do that somewhere on here. Fighting Fear with Kevin Ashworth. You can email me at kevin@nwanxiety.com or check out our Facebook page, Northwest Anxiety Institute. Thank you so much. Take care.